to this episode of The Operating Theater. I'm Dr. Kandu, and tonight we will be looking into a surgery that most Americans might have to get: coronary artery bypass surgery. Tonight, we have a special guest, Dr. Wildu. Dr. Wildu is one of the best cardiologists here in Texas.
Hi.
So, doctor, could you start by telling our viewers why people would get a bypass surgery?
People should get bypass surgery for a few reasons, but the main reason is that their artery or veins are blocked, and this blockage could occur, through several reasons, but mostly because they have bad eating habits or they just got an injury.
So how would bad eating habits cause an artery to be blocked?
Well, when people eat foods that contain high amounts of cholesterol, it doesn't get fully digested in the digestive system, so it starts moving around in the arteries and the veins, and these fats, these lipids, they start to deposit on the inside of the arteries, and they create blockages. And if the artery is injured, then the blood there will start to clot, and that creates blockages as well.
Thank you, doctor. Dr. Wildu, everybody. So to find out the actual procedure, we now bring in Dr. Muhammad Bihari, live in the hospital. So Dr. Bihari, could you take us through a step-by-step procedure for doing a coronary artery bypass surgery?
Okay, so the first what we do is take a look at the patient's medical history to see if the patient has any allergies to any drugs we give him or her. We then tell the patient the whole procedure so that we can get the approval from the patient.
So you need the patient's approval?
Yes, the patient needs to be comfortable with the surgery.
Is the surgery really that risky?
Not exactly. We give the patient general anesthesia, preventing his or her body from sensing any pain. While the patient is unconscious, the surgeon makes an incision on the skin over the patient's breastbone. Then the surgeon makes another incision on the breastbone and separates the ribcage, finally gaining access to the patient's heart. To avoid inflicting any damage on the heart, we stop the pumping of the heart.
If the heart does not pump, how will the blood circulate through the body?
We use the heart lung machine that assumes the heart's role during the surgery.
So where do you get the arteries or veins for the graft?
We get the veins and the arteries from the patient, just because it is safer and the body won't reject them. The most common blood vessel that we use are the internal mammary arteries. The other arteries that we often use are the radial arteries, the saphenous veins, gastroepiploic artery, and the inferior epigastric artery.
Dr. Kandu. Dr. Kandu.
The surgeon then sews the harvested blood vessel above and below the blocked artery. Exactly. Usually, however, we attach one end of the harvested blood vessel to the aorta. The open ribcage will be wired back together, and the cut skin will be sewed together. The entire procedure takes between 3 to 6 hours, depending on how many bypasses the patient receives. 3 to 6 hours? That's an insanely long surgery. But I guess patience is a virtue. Anyways, Dr. Bihari, thank you very much for your input, and we hope to see you again on the operating theater. Now we have Dr. Alcoholic, who will tell us the status of a patient after the surgery is complete.
Hi.
Dr. Alcoholic, I understand that the patient is put into the recovery room after the surgery, but is it actually possible to make the heart start beating again?
Of course. Recurrent pulses are conducted through the heart, making it beat again. We also attach a temporary pacemaker that functions just like the SA node in the heart. Usually patients stay in the hospital for the next 5 to 7 days. During these days, nurses pay careful attention to the patient's heart rate via a heart monitor.
Aren't bypass surgeries effective for the rest of a patient's life?
Nope. No. The prognosis of bypass surgery is such that they're effective 8 to 15 years after a surgery is performed. The graft itself could actually get blocked again. The patient needs to have good eating habits and reduce cholesterol intake so that it prevents the graft from getting blocked again.
I don't think that'll happen.
That's right. 99% of our patients went to McDonald's after their recovery.
Really?
No. No.
Well then, thank you very much for your special appearance, Dr. Kahalik. Don't drink and drive.
No problem. Hope to see you at the hospital. And you too.
I'm Dr. Candu, and I approve this episode of the Operating Theater on bypass surgery. Have yourself a great day.